Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with a dear friend of mine that you haven't met yet. Her name is Alexis Sanderson, and she is 8 years old, and she has spastic quadriplegic cerebral palsy. She's a level 3, level 4, which means she can walk with one handheld, not great, two hands pretty well. She can walk in a walker pretty well. For long distances transportation, she needs to have something like a wheelchair to be in. What we're doing today is Alexis is on whole body vibration unit. Whole body vibration is something that has been found to be clinically efficacious for cerebral palsy. I'm going to go ahead and turn it on. Alexis is able to hold on by herself. She can hold on to the back of her wheelchair when it's locked, and she can shake all by herself. The research says that whole body vibration, even in short increments, can decrease tone, increase coordination, and increase strength for about 30 minutes. Long-term effects, if it's used regularly, can improve muscle mass, bone density. It can improve gross motor skills, gait, mobility. It can decrease tone and spasticity and increase strength. It's something I use regularly in the clinic. A lot of my families have, get your foot back on, sweet pea. A lot of my families have got these in their home now to be able to use. I find that, for example, if I have them sitting and I help them put their hands down, that it really reduces the stiffness in the kids' hands. If I have them standing, it affects more their lower extremities. Look at you standing up like a big girl. One of the things I've just done here is I've used a little piece of a pool noodle and put it on the handlebars just to help keep her hands apart. Otherwise, she tends to adduct her hands. This is a really simple thing that you can do at home. This unit is whole body vibration. I got this one off of Amazon. This one's a pinty. I'm not sure that this one is available anymore, but the ones that in the price range that I tend to get, because I've replaced mine a couple of different times and families certainly get them, run around $100. Fortunately, right now it's considered a weight loss unit, so it's not a medical piece of equipment at this time. So it is something that is still relatively cheap. It is something I recommend and really like, and my kids tend to tolerate it very well. Alexis, you're doing so super. I hope you've enjoyed this, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.